If Congress does not act soon, lots of Californians could see their health care premiums skyrocket next year. The American Rescue Plan capped health care premiums at 8.5% of household income, but that expires at the end of 2022. John Baackes is the CEO of LA Care, which serves many of LA County's poorest residents. He says rising premiums could make health care unaffordable for many people who currently have it.
The biggest thing at stake here is the peace of mind of people who have health insurance, that they don't have to worry that if something happens, at least I've got something to fall back on. If you take that away from them, you've created yet another stress.
Healthcare enrollment through Covered California hit a record high last year, and officials say federal subsidies are the reason why. Baackes says legislation needs to be passed soon because of Congress's upcoming summer recess and the November elections. Congress is being urged to extend the cap on health care premiums under the American Rescue Plan.
The temporary plan capped health care premiums at 8.5% of household income. A lot of people paying zero under programs like Covered California.
By having the subsidy at the level it was, they could easily sign up, and then they only had to worry about meeting the co-payments and deductibles when they actually had a service.
John Baackes is the CEO of LA Care, a health insurance plan for low-income and vulnerable communities. He says 42% of their members don't pay premiums right now.
We're very concerned about it. So is Covered California, who are concerned that up to 500,000 people may find that change in the subsidy would cause them to disenroll.
Baackes wants Congress to act soon. The subsidies expire end of this year. Natalie Tavidian, KNX News, 97.1 FM.
If Congress doesn't extend a health care program, premiums for government insurance programs could go up. Some are saying it will cause more financial stress for hundreds of thousands of people.
Federal money came in as part of a temporary pandemic relief package. It cut down how much some pay in health care premiums.
We expected that a lot of people joined because of the additional subsidies that the American Rescue Plan offered. Our enrollment has grown. About 42% of our members now do not have any premium payment.
John Baackes heads LA Care, a health insurance plan for low-income and vulnerable communities.
If they suddenly have to start paying more, they may have to make a choice between, do I have health insurance or do I pay the rent?
Baackes says while many have to make co-payments, their monthly cost for insurance has been zero. He fears if the feds don't act soon, hundreds of thousands of Californians could be left without health insurance. Natalie Tavidian, KNX News, 97.1 FM.